What I want to cover today is the diverse role of nursing, of nurses themselves, some examples of what some nurses are doing, but also a little bit about what we could be doing, and maybe what nurses as a profession and nursing as a profession could perhaps do a little bit differently or a little bit more of. It might not please everybody in the room, some of the things I say. It rarely does. I've got a lot of Twitter followers and a lot of Twitter trolls, but there's nothing like controversy to make some progress. I loved some of the things I've just heard. Unfortunately, I've not been here for the whole conference. It would have been great if I had been able to do that. I like the national emergency title. I think it's beginning to feel like that to us. Certainly as nurses and at the college, that we do think things are getting to a very critical stage in our work with the homeless and the plight of people who are homeless, not necessarily on the streets. And of course, my title is Nursing on the Streets, but it isn't actually all on the streets, and everything that I cover today will not all be about nurses going onto the streets to treat people, although there is quite a lot of that there. And of course, homeless is a position that people have found themselves in. It is not a condition and it's not a disease. And therefore, their needs are very diverse. They're not a homogeneous group. And in the same way, neither are nurses who work with the homeless. And I was going to say there's no such thing as a homeless nurse, but sadly, there is such a thing as a homeless nurse. And we, sadly, in recent times at the college, have been assisting people who are working as nurses who have found themselves homeless through the support services that we provide. And increasingly, particularly in London, we're finding nurses themselves who are often sofa surfing between shifts because they can't afford to live close enough to the place where they work. So it is hitting even the professionals. So when we talk about homeless, I think we need to lose the image that is this, which is perhaps what most people do think of, but actually it's a much more broader population that nurses are working with. So where homelessness is often hidden in plain sight, so is homeless nursing. And there's so many roles that nurses are undertaking, and I suspect if I'd got the time to ask all of you put the hand up, there would be quite a diverse range of specialties, roles and different areas of employment as well. Nurses are frequently the navigators. They're the people who are closer to the person that they're caring for, and they're often the people who organise all the other services around them. So they're often the people who get closer and get the stories from those people who require some intervention. And there's been a very long tradition in nursing of going out to those hard-to-reach areas and solving those problems. In the early 1990s, there was a big movement in nursing. Some of you look old enough maybe to remember it, some of you perhaps not. There was a big move to take in from America the whole idea of nurse practitioners. In America, nurses were able to practice autonomously. They were able to give drugs under license, and they were operating entirely by doing differential diagnosis and treatment, quite often in those hard-to-reach areas of the States. And people came over, and there was a lot of toing and froing of how would that look in the UK. And those of you who'll remember may remember that the area that took it on almost immediately was nurses working in outreach into the homeless area, because there was very little support at that time, and nurses were filling that gap and finding solutions. They were also breaking the rules. So when I looked back at a case studies that I actually remember from those days and looked at what those nurses were doing, it was a little bit like the travel pass. It was on the edge of what was allowed. It certainly wasn't illegal, but it certainly was neither in the job description or in the things. So patient group directives, some of you might remember those, where nurses were able to give drugs with a directive that was done remotely from a medic. They were done very imaginatively in these services. and actually proved to be incredibly successful. And it was the specialist nurses working in homeless services that were fundamental to getting nurse prescribing enshrined in law. So there is a long history that you are all following in terms of slightly breaking the rules, pushing the boundaries in order to support the needs of the individuals that you're working with. But there's lots of different roles, from generalist to specialist. And I can give you some examples. Some of you might be sitting in here. I don't know all the people I'm going to mention by sight, so I do apologise if I get anything about you wrong, but I can guarantee I won't be rude about you. London have quite a strong network of nurses and midwives. There is a website, there's a homeless healthcare network, and there's some quite interesting practitioners who sit in that network, and we work with them where we can and intend to work even closer. We have tissue viability leads working specifically on wound care, on treatment and follow-up. Mental health interventions with rough sleepers, so mental health nurses working with them on those sort of needs. Midwifery specialists working in very complex situations, just to name a few. So how is this getting recognised, and where are our role models? How many of you know this person? Now, I know she's not here. No, well, that's very interesting. This is Susan Semple. Susan Semple won the Bevan Prize for Health and Wellbeing in 2015. So that's 3 years ago. It's not quite 3 years because it's done in July. She won this award. The other shortlist candidates were a consultant physician in elderly, a clinical psychologist who was breaking ground in their work, and a consultant for oral and a max-fax surgeon, basically. This is a nurse. There's a number of nurses who've won this prize. There's only one prize for an individual and one prize for an organisation each year, and it focuses on health and well-being. And what Susan did is she developed, and she herself developed the service, having, like you all know, persuaded, getting funding, persuading Health Service to give her that commitment and enable her to do that. And it's a nurse practitioner-led initiative in Belfast. And they have developed 23 homeless facilities and worked with them in a day centre for those on the street within North Belfast who require physical care. At the time, it was the only service in Northern Ireland that was engaged in meeting the physical needs of the homeless population. And the reason she won that prize is because of the phenomenal success she had in getting people to access dental and health services. And it was quite startling that nearly 100% of those people she was working with actually took up that offer of that care. And you all know how difficult that is. And she says it was about getting to know people, respecting them, and actually ensuring that the person they were working with was in charge of their situation. And I would recommend you to have a look at some of her work. She's also won an RCN prize for her achievements as well. But I think it's great that we've got someone who's showcasing their work and winning such a prestigious prize. Bit sad that none of you actually know about her, but do have a look and see what she's been doing. And she's a fantastic person as well, and I know that she would be really pleased to share her experiences and her thoughts with you. And I know that many of you yourselves are also doing similar sort of work. So the next picture this is about how do we speak out and showcase what we do. These are photographs that were submitted to us, and I do know that this team is here today. It's certainly on the list, whether you're here at the moment, I don't know, from the guys in St Thomas's team. And what we had in our centenary was we asked people to take photographs of their nurse. So 2 years ago, in 2016, it was the RCN centenary, and we wanted, for posterity, an album of what nurses were doing in 2016. And these fantastic ones that came into us who were on the finalists, they were finalists in the competition of nurses working with homeless people and the different things that they could do. And this was really important for us because this album is on the website, it's in all sorts of places, it's there for posterity, and it's important to us that we're able to demonstrate to other nurses what working with homeless people is. So what else are we involved in, and what else should nurses everywhere be doing? This is, you'll mostly recognise this is one of the cards from in London to enable people who are homeless to have in their pocket, so that if they're struggling to get treatment, that to show that they're entitled to it when they may be met with some of the hostility that we heard about earlier on. Sometimes people find it easier to have something that they can show rather than having to explain, probably for the 20th time to somebody, that they can actually have access to services. This is a card that's done by Healthy London Partnership and Groundswell, which we support too. And of course, one of the key barriers is access. And nurses are absolutely essential into that access. Not nurses, just nurses such as yourselves who are already very aware of it and working with it, but nurses more widely. Every GP has practice nurses. Every hospital has nurses. Every A&E has nurses. In fact, every health place you'll go to, there will be a nurse. Nurses don't work alone. Of course, they're part of a multidisciplinary team. But really is important that we can get to those nurses who may not have a specific special interest, who can actually ensure that people aren't as misunderstood and they get access to the treatment they require. And whilst we know there's lots of beautiful work going on locally, that can often get in the way. So we've got, when I was preparing for this, I've got so many examples of very local schemes, but they don't actually necessarily join up. So like the agencies aren't joining up necessarily, like the government isn't joining up. Some of the schemes don't join up either, which becomes quite problematic because it does assume that people are static, and people are not static and will move from place to place. And again, that's a way in which nurses can help. A little bit about what nurses are doing, and particularly what the RCN is doing, and working with others. Q and I are here. We know, I'm not sure, is someone from Public Health England here? Yep, great. So one of the things that the RCN has been doing for a number of years, we have a political leadership programme, which enables nurses working in practice to develop political leadership skills as well as their clinical leadership skills. And we've been working on the programme that can link to the Q&I network. Q&I, as you know, and you're here, so I can't speak for you, have amazing resources, online tools, assessment tools, lots of useful links and newsletters, etc., to support people. And what we are doing is developing support to people working in areas so that they can be politically aware and fight that cause and work in a political way to open up the boundaries and open up access for people they work with. And actually to tackle some of the entrenched problems. And some of those are medical, some of them are personal, and it is possible for people to secure positive health, but it takes a lot of navigation and an awful lot of work. So specific support on how to navigate the political environment. And obviously working with Public Health England with applying all our health, so linking all those together and providing a leadership programme that's available for our nurses working in that area. But of course, we talk about the NHS too often. The NHS is obviously our main focus, but I think all of these organisations are here, employ nurses, nurses work with them, and of course don't sit in NHS figures. So when we look at the workforce across homeless, it is very, very diverse. The RCN membership, we have 450,000 members, so we're quite a large army of nurses. Over a third of those nurses do not work in the NHS. And when I talk to Jackie Smith, who's the regulator at the NMC, she says it's more than that sitting on the register. So it leaves us with a couple of problems. It's no wonder we're short-staffed because all workforce planning is done on the basis of how many nurses will be employed in the NHS. And that is a massive number that will be working elsewhere and will be seeking jobs elsewhere. But it also maybe assists yourselves and people working in more marginal areas on how we get people interested in working in such areas by offering placements with Health Education England, working with universities, and not only developing access to specialist programmes post-registration, but getting placements for universities. And I would advise you all to try that at the moment, because as you know, allegedly there's going to be more students, and there will be a shortage of placements. So not only are nurses working in and employed by charities, we also have nurses that are hidden doing voluntary work as well as the work they might be doing otherwise, who are all part of our army of raising the profile but also solving those problems of different ways and sharing ideas, as you've been doing this time. This person here is Jason Warriner. Jason is chair of the RCN Public Health Forum, and he provides quite a lot of healthcare support at crisis as a volunteer. And there are so many, he says, at Christmas in particular, but generally of nurses who are happy to volunteer and wanting to volunteer, that it's sometimes quite different to coordinate. So, a little bit about the RCN and how moving away from nurses as practitioners, but nurses as lobbyists, nurses as members of a profession and members of our community who can raise issues, look for problems and lobby for solutions. We heard from my colleague at Shelter about the difficulty in getting action, and actually as activists, as nurses, we see it as very, very important. You may have noticed, actually every time I ask people they've not noticed this, but the RCN has gone into partnership with The Big Issue. Why The Big Issue? Not because we had a lottery and decided who, because we'd had an informal relationship with them for quite a long time, because any of you who've been to Cavendish Square, our headquarters, will see that there's always a Big Issue seller standing, selling The Big Issue outside our building. Nurses being nurses, they end up having a relationship with our nurses who come and visit, the nurses who work there, everybody knows everything about them. All this informal support started to happen because nurses are like that, and we decided last year to make it more formal. This is part of our, as an employer for our staff, not for our members, part of our social responsibility programme, which we take very seriously. And our choice is this, at the moment, is homelessness. And you will see that we have helped sponsor the tabards that they're wearing. You'll see the Royal College of Nursing logo on there. We thought we'd get a lot of flack from people on why you're doing that, putting the RCN logo on. We've had none, so hopefully people think it's a great thing to be doing. I think some people haven't noticed. I don't know how many of you have. It's across the whole of the UK. And the big thing about these that's different is they have pockets in so they can put their health card in and other things that they need. But what you will see is that there's a partnership between the two organisations, and Lord Bird, who's pictured there, controversial figure, but very, very active in the House of Lords on this issue. And really important we have a loud voice in the House of Lords as well as the House of Commons. And by working with us, he's been able to use the statistics that you provide us, that nurses give us, and use those in the House of Lords for the lobbying, quoting us and we're quoting them, and actually trying to get more of a positive movement. That also leads to us being able to get the message out to many more nurses and others. These are publications there about going to all nurses. The RCN bulletin goes out to every member, so that's 450,000 nurses have now had that on helping homeless people, how they can get involved, but also with some good case studies of the things you're doing to try and spread that and get more of a movement. And of course that the campaigning work on the other side, so one's about practice, one's about campaigning and trying to do more about solving the problem of homeless. And finally, active work itself. This is a member of staff who is not a nurse, but we have nurses there, as you'll see by the banners there. This is in Edinburgh, and the big sleep out actually taking place in that, raising money for the causes, but also promoting nursing and what nursing can do. And you can see they've got a little nursing part there where people could come and ask for advice. So a bit of a whistle-stop tour, but obviously nurses are such a wide group. There's lots you're doing, but an awful lot more we can do, and the RCN are looking at how we can bring more of it together and take it forward. So hopefully all of you that put your hand up will engage with us. Whether you remember or not, it doesn't matter, in trying to get more traction on this. Thank you.